leadership and on so many issues that relate to the well-being of the American people and our economy. Health care is 1/6 of the leg of the stool that holds up the republic. It is a major industry. When you look at all of our medical hospitals, all of our schools, the nursing profession, dentistry, and you take it all together, it is a massive employer across our country. And Congressman Garamendi, I mean, coming from California, your experience is so vast in terms of your leadership at the state level there, and now here as a member of Congress. So I'm very proud to stand with colleagues from New York and California, coastal powerhouses from the state of Ohio, right in the middle of the country there. And I wanted to add to your discussions this evening some real-life stories that illustrate what you've been talking about tonight. Here's a story from Toledo, Ohio, a real story of a couple that was forced to drop their health coverage after the wife got sick, and their health insurance premiums jumped from $800 a month in 2007 to $1,200 a month in 2008. How many families across our country, when somebody gets sick, the premium goes up? This bill is wonderful because it doesn't allow that to happen. For this family, the cost in 2009 would have risen to $1,600 a month with a $2,500 deductible. And so what did the couple do? They dropped their insurance. They couldn't afford the insurance, even though the wife was sick. But because of the law that we passed, the wife received coverage through a high-risk insurance pool that was set up within our state following the passage of the law, and they're paying $400 a month, less than they paid before, half of what they paid before, and they have a $1,500 deductible. Literally, the new insurance coverage saves them $15,000 a year, which for them was, I mean, unaffordable. That's why they dropped their insurance. But just that family alone tells us how important this bill is, this act is, and think of how many cases across this country have similarities to theirs. From Marblehead, Ohio, which is very central to the district that I'm privileged to represent, a small business owner, a woman, was diagnosed with lupus, and she was turned down by multiple insurance companies because she had a pre-existing condition. But because of this act and the high-risk insurance pool in Ohio, she was able to obtain a plan for $315 a month with a $2,500 deductible. That was her choice. But she has obtained insurance, though she has a pre-existing condition. How many Americans, have you said, have pre-existing conditions? This allows them to continue to pay, not be canceled, so they're contributing to the pool, the insurance pool, and they're able to take care of themselves. And finally, the third example I wish to place on the table is a senior citizen couple that faced a $3,000 to $4,000 bill in extra prescription drug costs after the husband developed a staph infection. How many families do we know have relatives that develop staph infections? And it required them to spend a lot more money in 2009 and 2010 on prescription drugs. Thankfully, the husband's health has improved, and they've saved money thanks to the donut hole provisions you talked about that took effect in 2010. So they didn't have to pay that extra money for the prescription drugs necessary that you have to take when you get an infection. You have to take those for a very long time, and they're very expensive. And the wife said of their situation, for seniors like Paul and me, living on limited income through Social Security, these costs were not a joke. And because of the Affordable Care Act, no senior ever will have to go through what Paul and I spent that year doing. And by the end of this decade, that donut hole will be completely closed at the rate of $500 a year. $500 a year to a senior citizen is a mountain of money. $50 is a lot of money because they're on limited incomes. Most people depend on Social Security to hold their lives together. So to get bills of $500 or $5,000, it's an impossibility.